Hello, my name is Francisnella Castro, and I am presenting my critical assignment on limited healthcare resources. My ethical dilemma: no one wants to have any type of dilemma in their life, but at one point, hard choices are needed to be made. The medical field is not one that escapes dilemmas, and unfortunately, they are made when people's lives are at stake. An ethical issue facing the field of public health or healthcare is that there are not enough resources to help everyone that needs them. When some think about not enough resources in the health, they might think not enough gauze or bandages, which in some cases is the point. But in the current world we live in, with the current pandemic, we are looking at limited ventilators and beds in the ICU for those who are really sick with COVID-19. Who are the doctors to be deciding who gets the last bed or the last ventilator to continue living? The goal of the ICU is to support patients until the cause of their illness can be treated or resolved. It is difficult to predict exactly when a patient may be well enough to be transferred out from intensive care. When someone from the ICU becomes better or has recovered to the point where they do not need intensive monitoring, they are to be transferred to what is called a step down unit. That's where they are still very closely monitored before being transferred to a regular hospital floor and then hopefully home. At that point, a bed becomes available, but who deserves it? Can there be anyone who thinks that there are enough resources and medication for those who need it? There has been much discussion of resource allocation in medical systems in the United States and elsewhere. In large part, the discussion is driven by rising costs and the resulting budget pressures felt by publicity funded systems and by both public and private components of mixed health systems. Reasonable people often disagree about when the difference in expected benefits mean we should favor best outcomes over fair chances, or even about what counts as a fair chance. Reasonable people often disagree about the choice, and it is not possible to simply dismiss one side as irrational or insensitive to evidence and argument. Reasonable people will disagree about how much priority to give the sickest patient. They may think we have to weigh the seriousness of an illness against the potential benefit that we know how to deliver. They may disagree about how to trade off those considerations, or they may disagree about when modest benefits to larger numbers of people outweigh greater benefits delivered to fewer people. Together, these unsolved rationing problems, the best outcome versus fair chances problems, the priority problem, which is how much priority to give those who are worse off, and the aggregation problem, which is when the modest benefit to more people outweigh significant benefits to fewer people. This means that there is persuasive ethical disagreement underlying many resource distribution problems. Political issues. People's medical status is always something that is brought up to be used as a political issue. New trade policies implemented in 2018 included imposing tariffs on goods from China, which disrupted supply chains for healthcare organizations for any array of medical equipment and supplies. The distributions not only raised costs for all stakeholders in the industry, they also impacted patients' access to treatment and medications. When the pandemic hit, the increased global demand for personal protective equipment, treatment, and life support, coupled with the trade tariffs, created shortage. The supply chain Civilization Task Force was indicated to address the limited supply of critical protective and life-saving equipment. The FDA set up a medical device supply chain notification system to monitor supply levels to prevent or to or reduce the impact of distribution on all stakeholders. The success of either of these programs so far during the pandemic is up for debate. Another current and future challenge is that at some point during the pandemic or the next, all countries will need to answer hard questions about whether and where scarce ICU resources be either withheld or withdrawn from certain groups of patients solely for the purpose of providing them to others. The ICU triage protocol and ethical guidance documents, many of which embrace the foundational principle of save the most lives. Unfortunately, this worthwhile goal has generated many suggestions that could violate the law. Ethical theories. There are multiple things to consider, such as the economic state that each individual is in. If their treatment is too expensive, but there is an alternative that is cheaper and still works, should they go with that one? Another idea to consider is whether a company should sacrifice their hard work, their research, and time that is paid to put together new medication and then provide it at cost without making any money. Considering that medication is limited, how will it be distributed amongst those in need? Will it be based off of geography, those that are closest to the facility, or will it be served to those that have more money? If money is an issue for medication to be manufactured, will they infuse that entity so that they could produce more, or will they limit the production to what the company can only make? Ethical framework. A healthcare practice that might help is if the clinic or hospital has a digital board that lets patients know how much medicine they have. As people are given the medication, the number is updated with the amount of medicine available, and it is first come, first serve. For example, the number of elective ICU admissions and the necessary resources can be planned and should be clearly linked to the strategy of the hospital system. If the number of elective operations done is consistent with the strategy of the hospital, then the corresponding amount of resources for post-operative intensive care should be available for these operations. This is a self-evident as it may sound, would logically have the consequence that rescheduling the elective surgery due to lack of ICU resources should never happen. All families want their family members to be the ones who get saved. As someone who has a very sick family member in the hospital, they don't understand that their family member could be less sick than another and yet still want the treatment for their family member. They don't understand the lack of limited resources. We are at the point where we are having to triage who deserves an ICU bed and who doesn't. The healthcare purpose is that they are trying to save the severely sick or as many severely sick as they can with the limited resources they have. People should submit medical applications with their age removed so that it is not a decision factor in whether or not they should be receiving the aid. Another recommendation is that companies should be giving a certain amount of money by the government in order for that company to give out medicine for free, and it is not coming out of the pocket of the company itself. Impact on health and wellness. Healthcare systems in certain countries face major problems during this time and are unlikely to offer the care needed. The scarcity in healthcare resources, training, and low numbers of healthcare workers are the most important reasons. The scarcity of healthcare resources, particularly in certain countries, has created ethical dilemmas, which is a huge impact on both health and wellness. This may include the need to provide care and treatment for more severely ill patients while delaying treatment for others who are in a better condition. They need to take such decisions. The need to take such decisions may cause some healthcare workers to experience moral injury or mental health problems. It becomes very challenging when such decisions have to be made at the expense of ethical values. What was learned? Due to the rapid spread of COVID-19, frontline healthcare workers may find themselves in an unpleasant situation where they have to make a choice of allocating scant resources for those who need them the most. We may ultimately become persuaded by a good argument that fairness requires a different decision than one that emerged from a fair process. Decisions are made on the basis of evidence and arguments, and better evidence and arguments may emerge that require revisiting some decisions. Some decisions can be modified, though it may be too late for others, and our consolation is that we made the best choice we could, given the evidence and argument. For the moment, with the evidence and current arguments, unfortunately, many lives have been lost due to limited resources our world has to offer. Here I have attached my references. Thank you for watching.